HIV. Prevention myths and reality. The human immunodeficiency viruses are two species of lentivirus that infect humans. Over time, they cause acquired immunodeficiency syndrome, a condition in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. Without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years depending on the HIV subtype. A few words why the problem of HIV is relevant among adolescents. The primary risk for acquiring HIV during adolescence comes from high-risk sexual behavior and drug use. Typical behaviors initiated during adolescence increase risk, such as sexual and drug experimentation, but little is known about the causal mechanisms associated with these behaviors among young people. Global HIV statistics. 26 million people were assessing antiretroviral therapies of the end of June 2020. 38 million people globally were living with HIV in 2019. 1.7 million people became newly infected with HIV in 2019. 690,000 people died from AIDS-related illnesses in 2019. 75.7 million people have become infected with HIV since the start of the epidemic. 32.7 million people have died from AIDS-related illnesses since the start of the epidemic. Prevention. Protecting yourself from HIV begins with understanding how the virus is spread. The person-to-person spread of HIV is called HIV transmission. People can get or transmit HIV only through specific activities, such as through sex or injection drug use. HIV can be transmitted only in certain body fluids from a person who has HIV. They are blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk. HIV transmission is only possible if these fluids come in contact with a mucous membrane or damaged tissue, or are directly injected into the bloodstream. Mucous membrane are found inside the rectum, the vagina, the opening of the penis, and the mouth. HIV can also spread from a woman with HIV to her child during pregnancy, childbirth, or breastfeeding. This is called mother-to-child transmission. Anyone can get HIV, but you can take steps to protect yourself from HIV. Get tested for HIV. Talk to a partner about HIV testing and get tested before you have sex. In Saratov, you can take an HIV test in the following places: Saratov Street, Мельничная, 69, Центр СПИД. Saratov Street, Рахова, 280, Центр ДНК-исследований. Choose less risky sexual behaviors. HIV is mainly spread by having anal or vaginal sex without a condom or without taking medicines to prevent or treat HIV. Use condoms every time you have sex. Limit your number of sexual partners. The more partners you have, the more likely you are to have a partner with poorly controlled HIV or to have a partner with a sexually transmitted disease. Both of these factors can increase the risk of HIV transmission. Get tested and treated for sexually transmitted diseases. Insist that your partners get tested and treated too. Having a sexually transmitted disease can increase your risk of getting HIV or spreading it to others. Talk to a healthcare provider about pre-exposure prophylaxis. It is an HIV prevention option for people who don't have HIV but who are at risk of getting HIV. Pre-exposure prophylaxis involves taking a specific HIV medicine every day to reduce the risk of getting HIV through sex or injection drug use. There are some myths about HIV and its transmission. HIV can spread as a result of touching someone who has it. In reality, the evidence shows that HIV is not spread through touch, tears, sweat, or saliva. You cannot catch HIV by breathing the same air as someone who is HIV positive. Drinking from a water fountain, hugging, kissing, and shaking hands with someone who is HIV positive, or, for example, using exercise equipment at a gym. HIV can spread via infected water or food. HIV can't live long outside the body and it can't survive in water. As a result, it is not possible to contract a trusted source, the virus, from swimming, drinking, bathing, or other activities involving water. Furthermore, it is not possible to contract HIV from sharing food with someone who has HIV, eating food with traces of blood on it, sharing toilets or bathrooms facilities, coming into contact with saliva, sweat, or tears. The virus can't survive exposure to the air or heat from cooking. Also, if a person ate food with traces of the virus on it, their stomach acid would kill it. It is not possible to live a normal life with HIV. If an infected individual actively takes antiretroviral medications, viral loads, and the progression of the illness can be prevented. A lot of people think HIV is a death sentence, said doctors. An important point is that HIV is eminently treatable. The treatments are well tolerated and most people have no side effects. As long as people get medical care and take their tablets, they can live a normal, healthy life.